You ever feel like this? Your neck just never relaxes and you're always trying to move it and you can't figure out how to get relief? Well, you're not alone. Neck pain, chronic neck pain, is one of the biggest problems that people face today. And I've gone through already in a series of videos some of the causes of that, and some of it is muscle problems. And so we gave you some exercises to work on that. And sometimes you have a disc problem, or you have a ligament injury from an old whiplash or a fall or something like that. But the most common reason why people have neck pain has to do with the individual joints in the neck causing the pain. And so I want to show you on the spine here what a normal healthy neck should look like. A normal neck has a forward curve like this. It's called a lordosis, okay? And so the biggest problem that we see in our office, without a shadow of a doubt, with people with neck pain, is they've lost this normal curvature. And now they developed a straight neck, or even sometimes what's known as a reversed curve. It's going the wrong direction. Now, why would something like that happen? Well, we've already gone through a few things, something like a whiplash where you get hit or you fall, where you hit your head. But the biggest reason is a lot of this. On our phones, on our tablets, on our computers, more and more forward head posture, head down posture, and that is taking a toll on us. So today I'm going to show you the fastest and best way to relieve that neck pain and neck tension, and that is with a chiropractic adjustment. So we're going to be using this tool. It's called the ArthroStem, to provide a specific chiropractic adjustment to relieve the tension in these joints, restore normal mobility so that you can start to get that arc back in your neck and start to actually get rid of your neck pain. So we've got Tim here today from our rehab department. Tim, sit down right there.
Yes, sir.
So I'm going to demonstrate what an adjustment looks like here with Tim. And now remember, the neck is supposed to curve forward, right? So in order for that to happen, the adjustment has to be applied in a certain position, like this, and then with a certain motion, like that right there. And you can hear this instrument is thrusting 12 thrusts per second. That is essential to restore normal brain to body and body to brain communication. So in the chiropractic adjustment, our job is to find the area of the spine that is not moving properly and to apply the gentle pressure in the right way to restore that normal motion so that you can get that arc back in your neck. How'd that feel, Tim?
Felt good.
All right, man. Thank you for demonstrating for us. Now, I want to tell you the consequences of not doing that. So we have here our spinal degeneration chart. This is for the lumbar spine, but it's the same for the cervical. Whenever your spinal joints begin to lose their normal motion, yes, you have more tension in the neck, yes, you may have more pain in the neck, but what's ultimately going to begin to happen is your spine is going to start to degenerate. And when that degeneration process starts, it will not stop until that normal joint mobility occurs again. And so what happens in the degeneration is you begin to lose disc height, the disc degenerates. You begin to get bone spurs on the bones because the bones begin to wear down, and ultimately then you end up with arthritis in the joints of the back. And this is where the problem actually starts from. And so with the chiropractic adjustment to mobilize that, you can stop that process from developing. And it'll also say that once that happens, it'll start to irritate the nerves, and then you get even more neck pain, maybe even numbness or tingling or pain down into your arms as well, or radiating up into the head and causing headaches. So what's the lesson from today? Number one, don't ignore neck pain that doesn't go away when you do your normal stretching and posture exercises. There's another problem, and no exercise, no matter how well you do it, how long you do it, will take care of a joint problem. You need to see a chiropractor who specializes in correcting those areas of the joint that do not move or are not aligned properly and restoring them back to normal motion. And if you do that, not only are you going to feel better, but you're going to be able to live life well for years to come. And that's what we want for you as well. So, till next time, God bless.